That brings me to ask you more questions about lung cancer, because 1st of August is observed as World Lung Cancer Day. So could you give our listeners an overview of lung cancer and what makes it such a challenging disease to detect and treat both?
Okay. So currently, as we say, lung cancer is the most common cancer worldwide. It's also a most common cause of deaths worldwide. In India, if we see, lung cancer is the second most common cancer, and it is becoming the leading cause of death. The challenging part in diagnosing lung cancer is that it is not detected early because the symptoms are very non-specific. And if we imagine lung as a 3D structure, if something starts in center, then till it reaches periphery or the surrounding organs, we are not able to have any specific symptoms. So that we do not go to a specialist earlier, and because of that, we are not able to detect it earlier. And if we are not able to detect it earlier, the treatments become complicated.
Correct.
If you require multimodality treatment, you require longer treatment, and that makes treating lung cancer challenging.
So what is a multimodality treatment that you just
So currently we don't treat lung cancer with single modality. We have multiple options. You have surgery, you have radiotherapy, you have targeted options, we have chemotherapy. Some patients are not fit for chemotherapy or surgery. We have local ablative methods like radiation or like radiofrequency ablation also. So treatment fields have evolved to encompass various type of patients. And those who are not able to undergo one type of treatment, we can treat them with another modality also.
Lung cancer, as you correctly said, is number 2 in India right now, in both the sexes or just in males and females?
So males is becoming number 1, in females it is still second.
Still second, and if we combine both the sexes, it becomes in number 1. Okay, so what are the most commonly used methods today to detect lung cancer? Because now we are talking about detecting lung cancer early is going to many-fold increase their survival rates.
Correct.
So do we have any methods of early detection today?
So previously we used to do sputum cytology and chest x-rays, but we have found that these methods are not sensitive enough to detect lung cancer early. So right now what we use is low-dose CT scans. So there are 2 large international trials which have found that if we do low-dose CT scans periodically in a high-risk population, we are able to detect lung cancer earlier by almost 30 to 40%. And then if we treat them early, we can prevent deaths. And that's the main goal of oncologists, to prevent death or make people survive longer.
Right. So the main goal of oncologist is to prevent death, catch the cancer early, treat it better. So to do that, low-dose CT scans, as you said, is the current method that's adopted, and those trials which you just mentioned are going on overseas, not in India.
Not
so when we are talking about low-dose CT scan trials that are going on overseas, not in India as well, what is the accuracy or sensitivity of these screening methods? And are we losing out on some true positives? Are we detecting some false positives?
Yes. So low-dose CT scans have their false positive rates, specifically in Indian situation where we have endemic illnesses like tuberculosis. So they will appear similar on low-dose CT scans, and you will unnecessarily expose those patients to additional investigation which can be harmful. Also, 2 small lesions or 2 slow-growing lesions are not easily characterized on low-dose CT scans.
I see.
And you will you are required to follow up them for a longer period.
Right.
And you might miss that opportunity to treat those patients also in between that period.
Right.
So there are some disadvantage of this low-dose CT scan method, as I told you.
Okay. So that's interesting. So tuberculosis and lung cancer, they will look similar on low-dose CT scan, and you need a very trained eye of radiologists to separate or differentiate them. And do you expect that every case will not be separated? I mean, it will land up on an oncologist table, like a tuberculosis false positive case can land up on your table, right?
Yes.
I see. So that brings me to ask you a question. What do you then look for a screening test? Like, what should it do? Should it be more sensitive? Should it be more specific? What should be it?
So ideally, a screening test to be effective, you should have a disease which is, the incidence of disease should be high enough, which as we can see, lung cancer is one of the most common cancer currently. Secondly, the screening test should be sensitive enough to detect even a small amount of change. or it should be very sensitive enough to detect a smaller nodule also.
Okay.
It should be specific enough so that you should not have false negatives.
I see. So what I'm hearing is that sensitivity and specificity both in balance are required to have a successful screening test. So that brings me to my next question. We know that low-dose CT scans are not popularly administered in India. What do oncologists here do to rule out lung cancer?
So currently there is no a standard policy for screening in lung cancer adopted in India. What we see that almost 95% of our patients, we detect them in third or fourth stage. Those patients who are detected early, the CT scans are done usually for another reason, not for as a screening method for lung cancer.
Accidental.
That's the catch actually.
I see. So accidentally lung cancer cases are found out. That's a very sad news here. So in a summary, lung cancer is leading cause of death and incidence in both globe and India, and we have very limited screening methodologies right now that are both sensitive and specific to come at the correct diagnosis in the earlier stages. Most of the cases are found out in third and fourth stages where it is very difficult to treat the patient completely. And as Dr. Pawar said, that it's medical oncologist's mission or goal to diagnose the patient and manage the disease effectively, and for that we need a very effective screening method. With this, we'll sign off for this episode, and we'll see you in the next episode with a lot more interesting facts and figures from Dr. Pawar. Thank you.